Atherosclerosis, meaning the buildup of plaques in the arteries, is a common inflammatory artery disease in people with type 2 diabetes that tends to get worse over time, and it plays a major role in 50% of deaths. In this video, I'm going to discuss what we know so far about how exercise can help to reduce those plaques and also reduce your chance of having a heart attack. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. In people who have heart disease or who have risk factors for heart disease like hypertension or type 2 diabetes, regular physical activity can help prevent the development of atherosclerosis, mainly through decreasing the body's production of inflammatory proteins. Coronary artery disease is a common condition in people with type 2 diabetes, and it's characterized by the buildup of atherosclerotic plaques. Now these plaques, these are caused by the accumulation or the buildup of fats, cholesterol, and other components. A plaque is a hard substance that restricts blood flow, and if that plaque ruptures, then that could form a blood clot, and that blood clot could further restrict blood flow, and this could potentially lead to a heart attack or a stroke. The content of that plaque can be different throughout the body and across different people. And the higher lipid content of the plaque, that's what increases your risk of having a cardiovascular event like a heart attack. Exercise can stop the growth of these plaques, and it can also help to reduce them, or reduce the size of them. This is referred to as plaque regression. Exercise can help reduce the lipid content in that plaque, and that makes the plaque more stable and less likely to rupture. Now, studies that investigate these variables, they're really difficult to perform, so there hasn't been much that's been done in this area. The only study of its kind at this point is a study by Westerbeckman and colleagues that had people with stable coronary artery disease perform high-intensity interval training twice a week for 6 months. Now, I want to go ahead and say at this point that anybody with coronary artery disease should be exercising under clinical supervision, especially if you're first starting an exercise program or if you're wanting to increase the intensity, because I'm about to talk about a high-intensity exercise protocol, and it's really important that you've got physician's clearance and that you're doing this under medical supervision. They either walked, ran, or bicycled at a high intensity, meaning between 85 to 95% of peak heart rate for 4 minutes. They then recovered by doing moderate intensity exercise for 3 minutes, and they did this 4 times for a total of 28 minutes. The HIIT exercise that they were doing was supervised. They were also encouraged to do cardio intervals on their own. This group was being compared to another group of people who had stable coronary artery disease. And this second group, they were just encouraged to follow the standard cardiac rehab moderate intensity physical activity guidelines. So we're comparing one group that did HIIT exercises twice a week, and we're also encouraged to do cardio intervals on their own, compared to a group that was just doing moderate intensity physical activity following standard guidelines all on their own. At the end of the 6 months, the lipid content in those plaques were reduced in both groups by 13 to 14%. So both HIIT exercise and moderate intensity physical activity were effective in reducing the lipid content in these plaques. Now, the HIIT group did improve their aerobic fitness to a higher degree, a little more than double that of the moderate intensity group. And when they looked at both groups combined, they saw a trend. The more the aerobic fitness increased, the more the lipid content in those plaques reduced. With the limited evidence that we have right now, the main take-home message is just get people moving and doing things that they enjoy doing that they'll continue doing on a regular basis. It is important to point out that 92% of the participants in this study were men, so we don't know if exercise affects women differently in terms of reducing lipid content in plaques. And as I mentioned earlier, people with coronary artery disease who are just starting an exercise program or are wanting to increase the intensity of their program, they should be clinically supervised. HIIT can bring many benefits, but there's also an element of risk that needs to be managed. And so it's really important that you discuss this with your doctor if you're wanting to increase your intensity. One example of the risk is one person in the study, they did experience angina, which is chest pain associated with coronary artery disease, and they did have to undergo coronary artery bypass surgery. This is one reason that I consistently mention throughout my channel the importance of discussing any changes to your exercise program with your doctor doctor if you have chronic conditions like diabetes or coronary artery disease. If you're ready to start tackling that plaque and reducing your risk for heart disease, have a conversation with your doctor. Thanks for watching.